Hello, my name is Lois Asiimwe. I'm a surgical oncologist at St. Francis Hospital in Nsambya. Cancer is on the rise in Uganda. We estimate that about 350,000 Ugandans are living with cancer, and every year that number grows by about 20,000. But beyond the statistics, we know that the actual problem on ground is much bigger. Oftentimes, many people, especially in the upcountry areas, may not have access to correct diagnosis of cancer. They may not have access to a pathologist who can make that final diagnosis. So we know that cancer cases are underreported and quite a number of people are actually struggling. We have a number of government cancer centers and a few private cancer centers, but the care that is available is nowhere near what is needed to manage this condition. So the most common cancers that we see in females is cervical cancer and breast cancer, and for males it's mostly prostate cancer and esophageal cancer as well. The digestive system cancers, which are cancers of the esophagus or throat, the stomach, and the large and small intestines, are definitely on the rise in both men and women. We've also been seeing HIV-associated cancers like Kaposi sarcoma, which is a cancer of the skin. However, with the control of the disease and the introduction of ARVs, these numbers are trending downwards. As I said, cancer is on the rise, so more and more Ugandans are being affected by this disease. And the nature of cancer is that it affects somebody's entire life. It affects them physically, it affects them psychologically, it affects their productivity, affects their finances, among others. And so many times when someone next to you is diagnosed with this disease, it affects you as well. Most times cancer patients require support not just of their medical team, but of the community around them. So we all need to band together to provide the support that is needed for these patients to recover and to fight this disease together. There are 5 things that you can do to reduce your cancer risk. 1, eat a healthy and balanced diet, which is rich in lots of fruits and vegetables and has a lot of whole foods. Secondly, be physically active as much as possible. Incorporate walking and different exercises into your routine to keep your body and your metabolic health good in order for it to fight cancer. Thirdly, maintain a healthy weight, because being overweight and being obese has been linked to a number of different cancers, and maintaining a healthy weight is one of the easiest ways that you can reduce your risk. The 4th thing I would say is prevention and treatment of infections. So there are certain infections that have been linked to specific cancers. For example, hepatitis B is linked to liver cancer. HIV is also linked to a number of cancers. HPV, or human papilloma virus, is linked to cervical cancer, certain cancers of the throat, and H. pylori is also linked to stomach cancer. So by avoiding these infections or treating them early, we are able to reduce the risk. For some of these infections, vaccines exist to prevent them, like hepatitis B or HPV, and getting immunized or getting vaccinated against these infections will reduce your risk for the cancers that are associated with these viruses. Finally, screening. Cancer screening is often looked at as a way of detecting earliest signs of cancer. in people who have no symptoms. But more than that, it is also able to detect the precancerous stages. So for example, in the development of colon cancer, it starts as a very tiny swelling called a polyp, which can grow over a period of 5 to 10 years to give you an invasive cancer. If during the process of cancer screening for colon cancer, we detect these small polyps or these small swellings, they can be removed before they have a chance to even grow into cancer. Same thing for cervical cancer. When we do a pap smear, we're able to detect the earliest changes towards cervical cancer, and we're able to remove any abnormal cells before they have a chance to develop the cancer. So I would say, after avoiding all the risk factors and modifying your life to one that is avoiding the risk factors for cancer, I would say cancer screening is our last defense to make sure, just in case you still get this disease, it can be removed even at the earliest stage. I would say there are 3 huge gaps that are still holding us back. The first is knowledge. Knowledge about the disease, what are the causes, what is the treatment, is a big problem in our country. And because people don't know what cancer is, they don't know the symptoms, many times they delay to come to hospital. Because there are many myths around cancer, it propagates that fear that delays diagnosis, making decisions about treatment difficult, and it is a big challenge in our community. Unlike many infectious diseases where everyone knows that if you have a fever, go and get checked for malaria and take this treatment. With cancer, there is a lot of unknown around it, and that complicates the fight significantly. The second gap, I would say, is finances. Because at every stage, when we are diagnosing, when we are trying to determine the stage of cancer, and during cancer treatment, there is a huge financial cost. And so if a patient is not able to come up with the money and come up with it in time to have timely treatment, then it becomes a really big challenge. And I would say the third challenge is access, because sometimes even when you have the money and you are aware of the problem, still the fact that all Ugandans have to line up at one facility to receive a specific service like radiotherapy becomes a challenge, because it's just not able to meet the demand that is placed on it. So I would say those are our biggest challenges: knowledge, finances, and access to care. So regular screening is important when someone feels healthy, because the earliest stages of cancer actually have no symptoms. So when you feel perfectly fine, when you have no pain, no swelling, nothing like that, it is actually at that stage that you may have cancer cells or abnormal cells forming in your body. And when we find cancer at this stage, when it's just a few abnormal cells and hasn't yet had the chance to grow or spread, that is the time when we have the best chance to treat and get the best treatment outcomes. Early treatment of cancer makes a huge difference in the prognosis or the treatment outcomes. For example, for breast cancer, if it is diagnosed at the earliest stages, which is stage 0 or stage 1, the survival after 5 years is 99%. So that means 99 to 100% of the patients are alive and well after 5 years, as compared to stage 4 of breast cancer, which is a stage at which it has already spread to other organs, where only 30% of patients are alive after 5 years. So you see that there is a big difference in the outcomes. we usually need more treatment options when we are treating an advanced stage like stage 3 or stage 4 compared to an early stage like stage 1 or stage 2. Screening is very important because it leads to early diagnosis, early treatment, and the best outcomes. Yes, cancer can be cured. However, in our treatment journey, many times we'll use different words. We may use the term survival, we may use the term remission, or we may use the term cure. So when it comes to survival, survival refers to how many patients are alive after a specific period of time, which may be 1 year or 5 years. When it comes to remission, we're talking about a situation in which after treatment, a patient has no trace of cancer in their body. And this is what we aim for when we treat our patients. However, for some of the patients who go into remission, there is a chance that they may get recurrence, which is when a few of the cancer cells, which are undetectable, hide in the body and eventually grow again and come back as a cancer. However, a good portion of the patients who go into remission also have complete cure, which is when there is no trace of the cancer after treatment, and after these patients go on to live several years and never get the cancer again. There are a number of treatment options that are available to cancer patients in Uganda, including local treatments and systemic or whole body treatments. For the local treatments, we usually refer to them as those that are targeting cancer in a specific part of the body, such as surgery. This is where we operate and we literally cut out the part of the body that has the disease, or that area, or the swelling or tumor that is involved in the disease of cancer. The other local treatment is radiotherapy, which is when we direct electromagnetic waves, which are kind of like X-rays, straight to the area that has the disease. These rays destroy the cancer cells and then make it possible to achieve either a complete cure or a partial cure of the cancer. We also have systemic treatments, which are the most common of which is chemotherapy, which is a type of drugs that destroy the cancer cells. These can be given in form of oral medication or tablets, or can be given in the form of IV drip that goes into the body to the specific area where there are cancer cells and destroys them. We also have a few new treatments like hormonal therapy, which helps your immune system to be able to detect the cancer cells and destroy them, and other treatments like hormonal therapy and others. Early diagnosis plays a huge role in improving treatment outcomes, because when cancer is found at earlier stages, we often need less complex treatment strategies, which are less expensive and cause less harm or less impact on the patient, with better outcomes. So say, for example, if we find breast cancer early, then we have a chance of saving the patient's breast, as opposed to late stages of breast cancer, which require complete removal of a patient's breast. In the earlier stages, we will often use maybe 1 or 2 treatment options, like we may use only surgery to treat the cancer, while with advanced cases, we'll most likely need a combination of different strategies, including surgery, chemotherapy, and a number of other strategies to control the disease, which the added treatment strategies also come with additional costs, and yet the outcomes at the later stages is never as good as at the earlier stages. someone who has been diagnosed with cancer, I would say take heart. There's a lot of stigma around a cancer diagnosis, and the picture is often painted to be much worse than it actually is. A cancer diagnosis is not a death sentence. There is hope for treatment, there is hope for recovery, and there is hope for you to live a fulfilled life thereafter. I would say you need to get in touch with a medical team to review your case, to advise you on what your options are and what treatments are available to you. You need someone to walk through this journey with you, and you can actually make it to the other side. You can have recovery, you can have treatment, and you can live a productive life thereafter. So the Rotary Cancer Run is important because cancer is a disease that affects us all, and the solutions or the treatment options that we require are quite costly, and they may not be easily borne by one institution or one individual or even one government. So we need to all band together to find solutions to this common problem that is affecting Ugandans. The funds that are raised through this cancer run make a huge impact. Over the years, the money that has been raised from this charity have helped so much in constructing this cancer center in Nsambya Hospital, which has been such a source of help and inspiration to a number of patients. We've been able to offer treatments like surgery, like chemotherapy, hormonal therapy, and palliative care to patients who need it, and that has been life-changing. So this 2026 run is going to take things to the next level as we look towards constructing another radiotherapy treatment center so that we have an alternative or a second center which can offer this treatment in Uganda. I invite all Ugandans to come and take part in the cancer run. It may seem like just a little money or may seem like a lot to you, but it's a case of everybody bringing their little together to make such a huge impact. So don't look down on that amount of money. Don't look down on the time that you will spend. Come for the cancer run, participate in a good cause, and we shall also be there to advise you on different aspects regarding cancer and regarding how you can get treated. One patient story that shows the real impact of this funding. I'm reminded of a patient that I worked on early last year who had breast cancer. We assessed her and did surgery. She recovered well from surgery. However, she needed radiotherapy as an additional treatment to prevent recurrence of the cancer. However, for this patient, even though she was referred to the cancer center, she kept being pushed on the list. She would be told, come back after another month, come back after 2 months. There's still a backlog of patients, and so it took an entire year before she was able to make it to the front of the line to receive her radiotherapy. This exposed her greatly to increased risk of recurrence, and it is unfortunate. You can imagine the emotional and psychological torture that she was going through, knowing that she needed this treatment but it was not available for her. And this is just one of many patients who have had to bear with their disease, who have had to be told to come back another time simply because there is only one cancer center that provides radiotherapy, and understandably they are overwhelmed by the numbers of Ugandans who need this treatment. So it is really unfortunate, especially for a patient who may not be able to afford to go out of the country and get this treatment. Ugandans are suffering. Ugandans are suffering and you have the solution. So let's band together as Ugandans and create and raise funds so that we can build a new radiotherapy unit that can be accessed by all Ugandans. Working in oncology is tough, but what keeps us showing up is the resilience of our patients. A cancer diagnosis is not an easy thing to deal with, but every day we see our patients show up, we see them try, we see them put in their all as they fight this disease. And if they are going through all that, then what right do we have to give up? So we can't give up. We are not giving up. We are determined to do the best for our patients. We're determined to support them on this journey, and we're determined to beat cancer.